The first few hours after waking up can be very telling when it comes to your health, especially if you have diabetes. Your body may exhibit subtle warning signs that indicate your blood sugar levels are not well regulated. Ignoring these early symptoms can lead to complications that affect your overall well-being. By understanding and recognizing these morning diabetes signs, you can take action to better manage your blood sugar and avoid potential health risks. In this discussion, we will highlight 7 dangerous morning diabetes signs that you should be aware of. Some of them may seem minor at first, but they can have significant implications if left unaddressed. Make sure to read until the end because sign number 1 might surprise you. One of the most common and concerning morning diabetes symptoms is morning hyperglycemia, also known as the dawn phenomenon. This occurs when your blood sugar levels are unusually high after waking up, even if you went to bed with normal or controlled levels. You may wake up feeling groggy, excessively thirsty, or slightly nauseous, and you might think it's just the result of poor sleep. However, for people with diabetes, this could indicate that their body is experiencing a surge in blood sugar due to hormonal changes. In the early hours of the morning, the body releases hormones such as cortisol, adrenaline, and glucagon to prepare you for the day ahead. These hormones signal the liver to release stored glucose into the bloodstream, which is a normal process. However, if you have diabetes, your body may not produce enough insulin to regulate this extra glucose, leading to high blood sugar levels upon waking up. For most people, the dawn phenomenon may go unnoticed because their body automatically regulates glucose through insulin production. However, if you have diabetes, this early morning blood sugar spike can cause fatigue, dehydration, headaches, and difficulty concentrating throughout the day. The impact of this hormonal spike is even more significant if your diabetes is not well managed or if your medications wear off overnight. If this happens regularly, it becomes harder to maintain steady blood sugar levels throughout the day, increasing the risk of complications like nerve damage, kidney issues, and cardiovascular problems over time. To keep this under control, it is essential to monitor your blood sugar levels right after waking up. If you notice a consistent pattern of high blood sugar in the mornings, consult your doctor about adjusting your insulin dosage or medications. A great way to help prevent morning hyperglycemia is by having a balanced bedtime snack before going to sleep. This snack should contain a combination of protein, fibre, and healthy fats to slow down digestion and prevent blood sugar fluctuations overnight. Eating a snack that includes nuts, yogurt, or whole grains can help stabilise your glucose levels, reducing the risk of waking up with high blood sugar. In addition to diet, making small lifestyle adjustments like regular exercise and stress management can also play a crucial role in controlling early morning blood sugar levels. Since stress hormones like cortisol contribute to the dawn phenomenon, practicing relaxation techniques such as deep breathing or meditation before bed can help minimize blood sugar spikes. Another concerning morning symptom is waking up with an extremely dry mouth and intense thirst. If you feel like you've just crossed a desert and need water immediately upon waking, it could be a sign that your blood sugar was too high overnight. When glucose levels are elevated, your body works hard to eliminate excess sugar through urine. This leads to frequent urination throughout the night, a condition known as nocturia. Many people with diabetes experience disrupted sleep because they wake up multiple times to urinate. Even though your body is trying to rest, your kidneys are overworking to remove the extra glucose, leading to dehydration. This is why you might wake up feeling extremely thirsty, with a dry mouth, chapped lips, and possibly even dizziness. If this happens often, it's crucial to monitor your blood sugar levels before bed and in the morning to determine whether high glucose levels are causing these symptoms. Staying hydrated throughout the day and adjusting your diabetes treatment plan with your doctor can help prevent excessive thirst and nighttime dehydration. One of the major reasons for waking up with excessive thirst is nocturia, or the frequent need to urinate at night. When blood sugar levels are high, the body attempts to flush out excess glucose by producing more urine. This puts extra stress on the kidneys, forcing them to work harder to remove the sugar from the bloodstream. As a result, people with diabetes may find themselves waking up multiple times during the night to use the bathroom, disrupting their sleep cycle. Over time, this constant nighttime urination can lead to severe dehydration, which is why many people with diabetes wake up feeling extremely thirsty. Dehydration can also contribute to other symptoms like fatigue, dizziness, headaches, and dry skin. To reduce the impact of nocturia, it's essential to keep blood sugar levels stable throughout the night. This can be done by avoiding sugary or carbohydrate-heavy meals before bed and ensuring that diabetes medications are properly adjusted. Hydration is also key. Drinking enough water throughout the day can prevent the body from becoming overly dehydrated overnight. However, drinking too much water right before bed can also worsen nocturia, so it's best to balance your fluid intake during the day. If frequent nighttime urination becomes a persistent problem, it's important to consult a doctor to rule out any underlying complications related to diabetes or kidney function. Another warning sign of morning blood sugar issues is blurred vision upon waking. If your eyesight feels fuzzy or unfocused in the morning, it may not just be due to sleepiness. It could be a sign that your blood sugar levels were too high while you slept. When glucose levels are elevated, excess sugar pulls fluid into the eye's lens, causing it to swell and temporarily change shape. This swelling makes it difficult for the lens to properly focus light, leading to blurry vision. While this effect can happen at any time of the day, it's often more noticeable in the morning if blood sugar has been uncontrolled overnight. Blurred vision from high blood sugar is usually temporary, but if glucose levels remain consistently high, it can lead to long-term damage to the eyes. Over time, diabetic retinopathy can develop, which occurs when high blood sugar damages the small blood vessels in the retina. This condition can cause permanent vision loss if left untreated. To protect your eyesight, it's important to keep blood sugar levels under control and take preventive measures like regular eye checkups, avoiding smoking, and wearing UV protective sunglasses. If you experience persistent blurry vision, it's a sign that your blood sugar may need better management, and you should consult your doctor for further evaluation. Managing morning blurred vision requires a combination of blood sugar control, lifestyle adjustments, and eye care. To minimize the risk of waking up with blurry vision, monitor your blood sugar levels before bed and ensure they are within a safe range. If your glucose levels tend to rise overnight, your doctor may need to adjust your medication or insulin dosage. Another important factor is hydration. Since dehydration can contribute to vision problems, drinking enough water throughout the day helps prevent excessive fluid shifts in the eyes. Additionally, maintaining a healthy diet that includes foods rich in antioxidants, vitamins A and C, and omega-3 fatty acids can help support eye health. Foods like leafy greens, carrots, fish, and nuts are excellent choices for keeping your vision strong. Regular eye checkups are also crucial as they can help detect early signs of diabetic eye complications before they become serious. If blurry vision persists for more than a few days, it's important to get your eyes examined by a doctor to rule out any long-term complications related to diabetes. Waking up with a throbbing headache is never a pleasant experience, but for individuals with diabetes, it could be an important warning sign of blood sugar imbalances. Morning headaches in people with diabetes are commonly caused by either hypoglycemia, low blood sugar, or hyperglycemia, high blood sugar, during the night. If blood sugar drops too low while sleeping, the brain, which relies on glucose for energy, may not receive enough fuel to function properly. This can lead to vascular constriction, causing headaches, dizziness, and even confusion upon waking. On the other hand, when blood sugar remains too high overnight, the body attempts to remove excess glucose through urine, leading to dehydration. Since dehydration is a well-known trigger for headaches, it can cause individuals to wake up feeling groggy and exhausted. Additionally, fluctuating blood sugar levels can cause increased pressure in the blood vessels of the brain, which may contribute to persistent morning headaches. Another possible reason for headaches in people with diabetes is obstructive sleep apnea, OSA, a condition that is more common in individuals with type 2 diabetes. Sleep apnea causes pauses in breathing during sleep, leading to low oxygen levels in the body. When oxygen levels drop, the brain responds by widening blood vessels, which can result in morning headaches. Many individuals with sleep apnea also experience chronic fatigue, excessive daytime sleepiness, loud snoring, and difficulty concentrating. If a person with diabetes frequently wakes up with headaches, especially if they also have these symptoms, it may be worth discussing sleep apnea with a doctor. Preventing morning headaches requires proper blood sugar management, ensuring that glucose levels remain stable overnight. Checking blood sugar levels before bed is crucial, as it helps identify whether they are too high or too low, allowing for necessary adjustments. A balanced bedtime snack that includes protein, fibre, and healthy fats can help prevent sudden glucose spikes or drops while sleeping. Since dehydration is a contributing factor, drinking enough water throughout the day is essential, but excessive fluid intake right before bed should be avoided to prevent frequent nighttime urination. In cases where sleep apnea is suspected, a medical evaluation and potential use of a continuous positive airway pressure (CPAP) machine may be necessary to improve breathing and oxygen levels during sleep. By maintaining stable blood sugar levels, staying hydrated, and improving sleep quality, individuals with diabetes can significantly reduce their chances of experiencing debilitating morning headaches. One of the most frustrating symptoms for people with diabetes is waking up feeling completely drained of energy, even after getting a full night's sleep. This overwhelming fatigue can make it difficult to start the day, leaving individuals feeling sluggish, unmotivated, and unable to concentrate. Morning fatigue in diabetes is often linked to unstable blood sugar levels during the night. When blood sugar is too high, the body struggles to properly convert glucose into usable energy. Instead of providing fuel for the body's cells, excess glucose remains in the bloodstream, leaving a person feeling drained and lethargic. On the other hand, if blood sugar drops too low while sleeping, the body compensates by releasing stress hormones like cortisol and adrenaline, which can interfere with restful sleep and cause individuals to wake up feeling unrested. Poor sleep quality also plays a major role in morning fatigue for people with diabetes. High blood sugar levels can lead to frequent urination throughout the night, disrupting the sleep cycle and preventing deep restorative sleep. Additionally, conditions such as diabetic neuropathy, nerve damage, can cause pain and discomfort, making it difficult to stay asleep. Restless leg syndrome, RLS, which is more common in people with diabetes, can also contribute to poor sleep by causing an irresistible urge to move the legs, particularly at night. If these factors continue over time, chronic sleep deprivation can develop, making morning fatigue an ongoing issue. Managing morning fatigue requires a combination of stable blood sugar control, improved sleep hygiene, and stress management. Ensuring that blood sugar levels are properly regulated before bed can prevent nighttime fluctuations that lead to exhaustion in the morning. Establishing a consistent sleep routine, such as going to bed and waking up at the same time every day, helps regulate the body's internal clock. Creating a calm and comfortable sleep environment, avoiding screen time before bed, and engaging in relaxation techniques like deep breathing or meditation can improve sleep quality. Since physical activity helps regulate blood sugar and improve energy levels, Regular exercise is also beneficial for preventing morning fatigue. By stabilising blood sugar, prioritising quality sleep, and adopting a healthy lifestyle, individuals with diabetes can wake up feeling more refreshed and energised. One of the more concerning symptoms that people with diabetes may experience upon waking is a tingling or numb sensation in the hands, feet, or legs. This is often an early sign of diabetic neuropathy, a type of nerve damage caused by prolonged high blood sugar levels. The nerves are responsible for transmitting signals between the brain, spinal cord, and the rest of the body. When they become damaged, they may not function properly, leading to unusual sensations such as tingling, numbness, burning, or even sharp pain. These symptoms tend to be more noticeable in the morning because nerve compression can worsen overnight, especially if someone sleeps in an awkward position that restricts blood flow. Diabetic neuropathy typically develops gradually over time and is more common in people who have had diabetes for many years or those with poorly controlled blood sugar levels. The damage occurs because high glucose levels can lead to oxidative stress and inflammation, which affect the small blood vessels that supply nerves with oxygen and nutrients. Without adequate circulation, the nerves begin to deteriorate, resulting in reduced sensation or abnormal nerve signalling. This can be dangerous because individuals with neuropathy may not notice minor injuries, cuts, or infections, increasing the risk of complications such as diabetic foot ulcers and infections. Preventing and managing diabetic neuropathy requires tight blood sugar control to slow down or stop nerve damage. Regular blood sugar monitoring, a balanced diet, and medication adjustments are essential for keeping glucose levels within a healthy range. Exercise is also beneficial because it improves blood circulation to the nerves and helps reduce symptoms. Since neuropathy can lead to serious foot complications, individuals with diabetes should check their feet daily for any cuts, blisters, or signs of infection. Wearing comfortable, supportive footwear and scheduling regular podiatrist visits can help prevent long-term damage. If neuropathy symptoms persist or worsen, a doctor may prescribe medications like nerve pain relievers to manage discomfort. By controlling blood sugar and prioritising nerve health, individuals with diabetes can reduce the severity of tingling or numbness and prevent further complications. Feeling nauseous upon waking can be a distressing symptom, and for people with diabetes, it may indicate a serious condition known as diabetic ketoacidosis, DKA. This condition occurs when the body cannot use glucose for energy due to a lack of insulin, forcing it to break down fat for fuel instead. This process releases ketones, which are acidic byproducts that accumulate in the blood. When ketone levels become too high, they disrupt the body's acid-base balance, leading to nausea, vomiting, stomach pain, and extreme fatigue. In severe cases, DKA can cause confusion, dehydration, rapid breathing, and even coma, making it a life-threatening emergency if left untreated. Morning nausea can also be caused by gastroparesis, a condition where high blood sugar damages the nerves that control digestion. This leads to delayed stomach emptying, causing symptoms such as bloating, nausea, and acid reflux. People with diabetes who frequently experience morning nausea should check their ketone levels, especially if their blood sugar is high. If ketones are present, immediate medical attention is required. Managing blood sugar effectively, eating smaller meals, and staying hydrated can help prevent nausea caused by digestive issues. Waking up multiple times during the night to use the bathroom can be more than just an inconvenience. For people with diabetes, it is often a sign of poor blood sugar control. This condition, known as nocturia, occurs when excess glucose in the bloodstream forces the kidneys to work overtime to remove it through urine. Normally, the kidneys help regulate blood sugar levels by filtering waste, while reabsorbing useful substances like glucose. However, when blood sugar levels rise too high, The kidneys become overwhelmed and are unable to reabsorb all the glucose, leading to excessive urination. This process not only disrupts sleep but can also result in dehydration, further aggravating symptoms like morning headaches, dry mouth and extreme thirst. Nocturia can have a significant impact on quality of life, leading to fatigue, poor concentration and increased stress levels due to interrupted sleep cycles. In some cases, frequent urination may also indicate the presence of urinary tract infections, UTIs, which are more common in people with diabetes due to the increased presence of sugar in the urine, creating a breeding ground for bacteria. If nocturia is accompanied by burning sensations, cloudy urine, or pain while urinating, it is crucial to seek medical attention. Managing nighttime urination starts with controlling blood sugar levels through medication, diet, and regular physical activity. Avoiding excessive fluid intake before bed, particularly drinks containing caffeine or alcohol, can also help reduce nighttime bathroom trips. For those experiencing persistent nocturia, a doctor may adjust diabetes medications or evaluate kidney function to ensure there are no underlying complications. One of the most concerning symptoms of uncontrolled diabetes is the slow healing of cuts, wounds, or bruises, particularly on the feet and legs. This happens because high blood sugar levels can damage blood vessels, leading to poor circulation and reduced oxygen supply to injured tissues. When blood flow is compromised, the body struggles to deliver essential nutrients and immune cells to the affected area, slowing down the healing process and increasing the risk of infections. For individuals with diabetes, even a small cut or blister can develop into a serious ulcer or infection, potentially leading to severe complications including gangrene and amputation if left untreated. Slow wound healing is particularly dangerous for those with diabetic neuropathy, a condition where nerve damage reduces sensation in the feet and legs. Since people with neuropathy may not feel pain from small injuries, wounds can go unnoticed and worsen over time. This is why daily foot checks are essential for individuals with diabetes. Keeping blood sugar levels stable is the most effective way to promote proper wound healing, as well as maintaining good foot hygiene, wearing well-fitted shoes, and avoiding walking barefoot to prevent injuries. In cases where wounds show signs of infection such as redness, swelling, pus, or a foul odour, immediate medical attention is necessary. Some individuals may require antibiotics or specialised wound care treatments to prevent complications. By taking proactive steps to protect the skin, improve circulation, and monitor injuries closely, people with diabetes can significantly reduce the risk of slow-healing wounds leading to severe health issues. Sudden, unexplained weight loss can be a red flag for individuals with diabetes, particularly if it occurs rapidly and without changes in diet or physical activity. While many people associate diabetes with weight gain due to insulin resistance, some individuals, especially those with type 1 diabetes or poorly controlled type 2 diabetes, may experience significant weight loss due to an insulin deficiency. Insulin is a hormone responsible for helping glucose enter the body's cells to be used for energy. When insulin levels are too low or ineffective, the body cannot properly absorb glucose, leaving cells starved for energy. In response, the body starts breaking down fat and muscle to compensate for the lack of fuel, leading to dramatic weight loss. In addition to weight loss, people experiencing severe insulin deficiency may also notice symptoms like increased hunger, excessive thirst, and frequent urination, as the body tries to flush out excess glucose through urine. If left untreated, this can escalate into a life-threatening condition called diabetic ketoacidosis, DKA, where the body produces high levels of acidic ketones due to the breakdown of fat for energy. DKA can cause nausea, vomiting, confusion, and extreme fatigue, requiring immediate medical intervention. To prevent unexplained weight loss due to diabetes, individuals must monitor blood sugar levels closely and ensure proper insulin management. A well-balanced diet rich in protein, healthy fats, and complex carbohydrates can help maintain weight and provide the necessary energy for the body. If weight loss continues despite proper diabetes management, consulting a healthcare provider is essential, as adjustments to medication or insulin therapy may be needed. Addressing weight loss early can prevent complications such as muscle wasting, malnutrition, and extreme weakness, ensuring that the body receives the fuel it needs to function optimally. Feeling constantly hungry, even shortly after eating, is a common sign of poorly managed diabetes. This condition, known as polyphagia, occurs when the body's cells are not getting enough glucose for energy. In people with diabetes, insulin dysfunction prevents glucose from entering cells efficiently, leaving them starved for fuel. As a result, the brain signals the body to eat more in an attempt to satisfy its energy needs. However, because glucose remains trapped in the bloodstream rather than being used for energy, excessive hunger persists despite food intake. This uncontrollable hunger is particularly common in individuals with uncontrolled type 2 diabetes or those experiencing insulin resistance. Even though they are eating more, their bodies struggle to use glucose properly, leading to continuous hunger and weight gain in some cases. On the other hand, in type 1 diabetes or individuals with insulin deficiency, the body may break down fat and muscle for energy instead, leading to weight loss despite increased appetite. If left unmanaged, extreme hunger caused by blood sugar fluctuations can result in overeating, unhealthy food choices, and further blood sugar instability, creating a cycle that worsens diabetes symptoms. To manage persistent hunger, individuals should focus on balancing meals with high fibre, protein-rich and healthy fat-containing foods that promote longer-lasting satiety. Instead of consuming refined carbohydrates, which cause rapid blood sugar spikes and crashes, choosing whole grains, lean proteins, nuts, seeds, and vegetables can help regulate hunger hormones and maintain steady glucose levels. Staying hydrated is also essential, as dehydration can sometimes mimic hunger signals. Regular blood sugar monitoring is crucial to identifying patterns of extreme hunger and adjusting medication or insulin doses accordingly. If excessive hunger persists despite a well-balanced diet and stable blood sugar levels, consulting a healthcare provider is recommended to rule out other potential underlying issues, such as thyroid dysfunction or gastrointestinal disorders. By adopting a nutrient-rich diet, monitoring blood sugar closely, and making lifestyle adjustments, individuals with diabetes can effectively control hunger and prevent further complications associated with fluctuating glucose levels. Diabetes can affect the skin in several ways, often serving as an early warning sign of blood sugar imbalances. Common skin issues include dry, itchy skin, dark patches, acanthosis nigricans, slow healing sores, and bacterial or fungal infections. High blood sugar weakens the immune system, making people with diabetes more prone to infections, especially in areas where moisture accumulates, such as under the arms, between fingers and toes, and in skin folds. Poor circulation can also contribute to delayed wound healing and increased skin sensitivity, making even minor cuts and bruises dangerous if left untreated. Proper blood sugar control, good hygiene, and moisturising can help prevent skin complications. If skin conditions persist or worsen, consulting a doctor is essential to prevent further complications. Blood sugar fluctuations can have a significant impact on mood, causing irritability, anxiety, depression, and difficulty concentrating. When blood sugar levels drop too low, hypoglycemia, the brain is deprived of glucose, leading to symptoms like confusion, nervousness, and mood swings. On the other hand, high blood sugar levels, hyperglycemia, can cause fatigue, frustration, and difficulty thinking clearly. These mood changes are often unpredictable and can interfere with daily life and relationships. Managing stress, getting enough sleep, and maintaining stable blood sugar levels through diet and medication can help stabilise mood. If mood swings become severe or persistent, seeking support from a healthcare professional or therapist can be beneficial. Yeast infections are more common in people with diabetes, particularly in women, due to the presence of excess sugar in bodily fluids, which provides an ideal environment for yeast growth. High blood sugar weakens the immune system, making it harder for the body to fight off infections. Common symptoms include itching, burning, redness, and discomfort in affected areas, particularly in warm, moist regions like the mouth, oral thrush, under the breasts, and the genital area. Keeping blood sugar levels under control, wearing breathable clothing, and maintaining proper hygiene can help prevent recurring infections. If yeast infections become frequent, a doctor may prescribe antifungal medications or suggest adjustments to diabetes treatment. Shortness of breath can be a serious symptom in individuals with diabetes, potentially indicating complications such as diabetic ketoacidosis, DKA, heart disease, or kidney problems. In DKA, the body produces excess ketones, which can cause symptoms like rapid breathing, fruity smelling breath, nausea, and confusion, a medical emergency requiring immediate attention. Diabetes also increases the risk of heart disease and fluid buildup in the lungs, leading to breathing difficulties. If shortness of breath occurs suddenly or frequently, seeking medical help is crucial to rule out life-threatening complications. Proper diabetes management, a healthy lifestyle, and regular medical checkups can help prevent these severe conditions.